And at the end of the day, insurance is to protect you for your health needs.
Medicare is simplified so they can enjoy their retirement.
On October 1st, we are now allowed to talk to you about all the plans in your area.
Those scary words are already upon us, AEP.
And when we got that back to him, he was in tears, just thankful for the resources. Nobody was really able to help him where he was.
The Monday after is the mad rush of the Medicare season.
I really try to look at us as an advocacy group for our MediConnect clients because we're trying to advocate on their behalf.
Well, welcome to this edition of the Medicare Made Simple Podcast with MediConnect. I am Lance O'Brien, CEO, and today's guest is Lauren Yuran, Director of Client Experience here at MediConnect.
Thanks for having me today, Lance. I'm super excited to be here and get the ball rolling with client experience.
Yeah, I mean, those scary words are already upon us. AEP, I guess they're letters and not words, although they stand for the Annual Enrollment Period, which I know for you is... You're busy throughout the year, but that's a big time of year for you.
Absolutely it is. You know, managing our clients, the clients that have been with MediConnect over the years, which is ever growing, our job grows every single year along with that. Our responsibility grows. We have a responsibility to our clients.
Yeah, I mean, in the last 12 months, we've added about 12 to 13,000 clients. Pretty big growth that we have gone through, which has been absolutely amazing. So talk to us just a little bit about your background and what client experience does.
Absolutely. So my background, I've been with MediConnect now 4 years. Can you believe it?
Wow.
Feels like yesterday. And I've been in the industry. This will be my 15th annual
Wow.
enrollment period. I had to add it all up in there. But so 15 years. I worked for some of the carriers prior to joining the team here at MediConnect. That's how I knew you all. So, in the past, I ran a territory of about 34 counties, was driving all throughout annual enrollment period back in the day when we had to carry all those enrollment books with us and distributing those to all the agents so that all the members could view their plans. Little different today. Now we have technology. Now we can easily email some of those materials to folks so they don't have to read all that and carry it around. And then client experience specifically, I joined that team about a year and a half ago. So with some of my experience from the carrier partners, had worked member services, had done reviews for clients, had been on a elite client team with one of the carriers as well. Tried and true to my heart. So we take care of our clients. We try for the white glove treatment. I was talking to you about a story a little bit ago that we're going to share.
Yeah, go ahead. Let's share it now. Let's jump right in.
Again, annual enrollment period. We are very busy. We have a lot of reviews, a lot of clients to make sure they're understanding their choices for the upcoming year. But all year round, we don't stop. And, we help with billing issues. We help with somebody has a question about their plan benefits. But today we had a really, really cool call come in. We had a client. Unfortunately, he is going through some really big medical issues. He broke his hip and he is now had hip surgery in a skilled nursing facility and going through rehabilitation.
Yeah, which is a lot.
It is a lot. But on top of that, this gentleman also is the caregiver for his wife who is going through dementia. So him not being there to assist her is an added weight onto what is already a very extreme situation.
Sure.
So, really it's like, what can MediConnect do, right? Well, he called in. He's not getting any resources. He's scared, that his wife is home. He's scared that he won't be able to get up the steps completely. He knows he needs home health visits and help rehabilitating to be able to get up the stairs. But he's also worried about his wife and who he cares for. So, we were able, he's not very technologically savvy. So we were able to get a bunch of resources together, print all the materials and mail them to him in the skilled nursing facility. He called in, he wasn't even asking a question. He was just expressing his concern of his situation. When we got that back to him, he was in tears, just thankful for the resources. Nobody was really able to help him where he was, know anywhere to turn.
Yeah. No, and that's pretty amazing because, again, it's not just what he's going through, it's what his wife's going through. And being able to have a consistent resource. And I think that's really important because that was the heart behind starting client experiences. Anybody who's been on Medicare for a little while and is familiar with how it works, Lauren, generally you have, for lack of a better way of saying it, you have a salesperson, right? You
Exactly.
have a broker, an agent that meets with you. Well, that broker or agent who does the initial sale usually ends up doing the service as well.
Exactly.
And if you know anything about salespeople and businesses in general, there's a very clear divide between selling and servicing, you know?
It's funny because I have a few friends in that broker world, right? Because of where I came from. And I was explaining to one of them my job role here at MediConnect and what that had grown into. And they said, "What do you mean customer service? I just tell my people to call the carrier and hang up." So, that's what we're giving folks. And we're here to help connect them because it's so hard sometimes. There's certain phrases that you need to use or certain terminology. We say AEP, the annual enrollment period, but there's almost Medicare's own language. And I like to think we help translate that. There's also language that providers' offices use. I can't tell you how many billing issues a week we get where the provider's office may have coded it incorrectly to the insurance company, but you're getting a bill from the insurance company. So people are confused at where that broke down, but it could have been as simple as just a typo at the front desk of your provider's office.
Yeah, and our goal with client experience was one, not we have great carrier relationships, but sometimes there can be barriers with
Mhm.
the carriers. I didn't even mean to do that, but that was pretty good, huh? I should freestyle rap sometime maybe, but there could be barriers with the carriers, right? And maybe it's a language barrier,
Mhm.
maybe it's a bandwidth barrier
Mhm.
where they're trying to get through and it's an hour. Like there's a lot that happens there. And for us, we're like, we want to be able to create a department where our clients can call in if they have a billing issue, if they need help with a prior authorization, if they don't understand a certain part of their benefits, and they can really get that personal touch and help that they need.
I really try to look at us as an advocacy group for our MediConnect clients because we're trying to advocate on their behalf, whether that be a contact with the doctor's office, whether that be contact with the insurance company. Sometimes it's as simple as, somebody needs help and they want a loved one to be on the call with them, and we can three-way that call to get their loved one to be a part of that and understand what's going on. Like today's situation, it's not just about the client, it's about his wife.
Yeah.
I know he has some kids that are helping, but they also don't know where to turn. So bringing that team of people, that care team in and being able to help them all get the resources that they need and get the understanding that they need.
Yeah, so like I know that was a lot of introduction, but I think it's really helpful because we're going to talk about the annual enrollment period today. We're going to
Mhm.
talk about how people should be preparing for that. And I know for you, you're preparing a lot for that because you're going to be literally helping tens of thousands of clients over the next 6 to 10, 12 weeks or so. So, yes. So, what we want to do is we really want to just jump in today and talk about how can people prepare for this time period. So, I'll ask some questions. We'll have some back and forth and just a great conversation that's going to help people. So, let's start here. As we approach the annual enrollment period, we're the middle of August now.
Mhm.
And, what is the first bit of information they should be looking for?
Well, if they're a MediConnect client, we'll be sending out a reminder telling you that your annual notice of change is coming. But if you're not a MediConnect client, that first piece, and for our clients, will be what we call the ANOC, the annual notice of change.
Yeah. And, I really want to make this differentiation because there's a lot of people out there that are like, just send me the Medicare and U book, which again, I have no problem with the Medicare and U book. It does give high level, and I think that wording is really important, high level overview of the plans that are going to be available the next year. But one of the things that we're required to do when we sit down with somebody and review a plan is we're supposed to go through the whole summary of benefits,
Correct.
which usually in there's 80 to 100 different things, where the Medicare and U book is only going to have 7 to 10 things across one line. It's giving a very high level, small look into what the plan's going to cover.
And the Medicare and U book has a lot of information. It doesn't have the detailed information about your specific plan. So if you're basing your situation off of that limited information per plan that's there, you might make a wrong choice for your needs. And then also, it's a lot of different plans, and it's very confusing to read and to get through and know what's what because, again, it's a book this thick that has all of this information.
Yeah, I mean, basically it's page after page of plans and graphs, and like you said, it can be overwhelming for the average consumer and underwhelming
At the same time.
ultimately because it's not giving them everything. So that's where this annual notice of change comes in. So let's start with this. What is good or positive about the annual notice of change?
It's going to be specific to your plan, each and every change year over year. So basically, they're going to send this to you by the end of September, is when it's supposed to be in home. And it's going to list everything on your plan that has changed year to year. So, did your premium go up or down? Did your specialist cost change? But maybe again, something that's not going to be in the Medicare and U book might be some of the ancillary benefits like dental and vision. There might be a checkbox in the Medicare and U book,
Right.
but they might tell you, hey, you got an additional $1,000 in your dental or something of that nature. So it might be a positive change, it might be a negative change, but it's going to line by line explain all those changes to your plan.
Yeah, so I think that's really positive because, again, if somebody's happy with their plan, maybe they're a low utilizer or they did use it and they were happy with the results of it, that's going to give them a good snapshot of this is what's happening with the coverage you already have. So, yes, a positive is that it is tailored to them. What's a negative of it?
It's going to be the same thing we just said. It's a negative to you. So again, you're looking at one plan. How many plans did you say on average are in that Medicare and U book?
Well, in every county, there's somewhere now between 60 and 70, and that book is going to cover multiple counties.
Right. So, there might be 60 or 70 plans in your area. There might be a plan that's a stronger fit for your situation, but you're only going to be able to see the plan that you're on and the changes that happen to that. So you're not going to see the rest of the changes throughout the entire market of other plans with that same carrier sometimes and other carriers as well.
Yeah, so the fact that it's tailored to you is great. You're going to be able to know, okay, I know I'm paying this much. This is what's going to change to. This is what my specialist copay has been. It's gone down or up $5 or whatever it might be. But the fact that it's tailored to you is it is giving you a very myopic or small lens picture of the overall landscape of what's happening with Medicare, where it's not showing you the other plans in the market, only the changes to your current plan.
Correct. And like you stated, Lance, some people have been on their plan for a while. Some people have been comfortable with that plan. But again, there could be some negative changes, and that doesn't mean there might be another option for you, even within the same carrier, that has now been crafted or had some good updates, but you didn't get that ANOC, you got the one on your plan. And we always talk about that importance every year of reviewing your benefits because you don't know what else is out there.
Yeah, and we'll even have people that will call us when they get their ANOC and it's not very long. I mean, if there's not a lot of changes, it could be 3 or 4 pages. And they'll be like, I don't really understand what I'm looking at, right? Can you explain this to me? So we do deal with that as well.
Yeah, and we're allowed, when they get that annual notice of change, we can have a conversation about your plan. However, we're not allowed to talk about the other plans in the market until that October 1st date.
Yeah, which we're going to get into dates and deadlines in a little bit, but I do think that's a great point that you bring out is we're going to, before October 1st, we can go over how their plan is changing and help them start to formalize a plan of, hey, this is something I need to really put some time and effort into this year, or this is something that I feel pretty comfortable and I can just let my coverage roll over.
And, again, in those annual notice of changes, you might get a notice that maybe your prescription is no longer being covered by that plan. And I've had that happen every single year where somebody's going, what do I do? And again, we will help you out, but until that October 1st date, we might not be able to look at the other formularies in the area or give you that information, but just trust in the fact that we've got you and we can get you an appointment scheduled. And it's really important that if you're dissatisfied with changes in that annual notice of change, that you set up a review with your MediConnect client experience team so that we can take the time to go over the options and find you something that's suited for your needs.
Yeah, no, that's a great point. So like if you get the annual note of change and it has coverage on your hospital and maybe it went from a per stay, maybe you paid $250 for the whole stay, and then it went to a per day where you got to pay 200 a day for days 1 to 4, that's where you're going to really be like, well, I'm wondering if this is still the best coverage for my situation. So that ANOC, just annual notice change, just to give people an idea, that's going to come under cover of your current carrier. And what I mean by that is if you have Aetna, you should be looking in early to mid-September when you're getting your mail every day. You want to be looking for something from your carrier that's going to be talking about your changes for the upcoming
And I
year.
love that example that you just gave of like the hospital stay, right? Per stay to a per day. But what if, again, you love your policy and you've been on that for a long time and you want to stay there, but you really just don't like one or two of those things? We also offer other products. Indemnity, hospital indemnity products,
Yes.
cancer, heart attack, and stroke policies that can actually help fill some of those gaps. And again, some of those start as low as $20 a month. So there might be one negative thing, but you like the other positives. We can actually find some additional products to help fill in those gaps of what the changes in the plans were.
No, absolutely. And that's really the goal, is let's look at it holistically, make sure you have the best coverage. So we've been talking about the annual changes that can happen. We did give one example. What are the most common things from year to year that have a tendency to change when it comes to people's plans?
So we had mentioned prescriptions a little bit. Sometimes there are formulary changes. That's a big one. So there might be in that annual notice of change, you see that your prescription is no longer covered or no longer a part of that formulary. And there's a couple different things you can do. And that's where we're going to come in and walk through those options, see if other plans are covering that medication, see what those options would be for you. But prescriptions are going to be, one of the ones that change year over year.
Yeah, I'm in 100% agreement with that, whether they change tier, if the pharmacies that are preferred change, because
Hmm.
sometimes that happens, if they no longer cover a prescription. So I think that is the biggest thing that changes generally. Secondly, I think a lot of times and it's usually not big shifts, but premium is something that can
Hmm.
often change from year to year.
Oh, absolutely. And again, from working for some of the carriers as well, they have to bid these plans back at a certain point, get them approved by Medicare. And even in that time frame, we would see those change before they were released to the public.
Yeah.
And premiums are, going to change. It's always like a pendulum. Some years they're going to go up, some years they're going to go down. Some years they might stay relatively similar. I know they don't usually want to increase that as much, but we've seen in years where there've been big premium increases as well. So that's something you want to pay attention to. And you had mentioned earlier, what if you're a low utilizer? Because we have people that are higher utilizers using the benefits. We have people that are maybe not utilizing them as much. And then they're going, oh, well, I don't want to pay this much per month. So again, we do have zero premium options. And you might not like that increase in your plan. We can probably save you on premium. There is definitely other options.
Yeah, and I think we've been a little bit spoiled here, specifically in Western PA and Pennsylvania over the last few years, where I shouldn't say last few, I'd say really from 2016 to 2023 or 24, we saw one thing with the premiums.
Mm-hmm.
They just went down.
Mm-hmm.
Now, the last few years, we've seen some incremental increases, some flatlining. So yeah, you want to be looking at the premium, want to be looking at prescriptions. And I think this one I think is a big one, because the last 2 years specifically, there's been a bunch of crawlback on this, and that's the ancillary benefits.
Mm-hmm.
Talk to us a little bit about what are ancillary benefits and what has been changing.
Absolutely. So ancillary benefits would be considered those extras, those bells and whistles, what original Medicare itself does not cover or deem necessity, right? So eyes, ears, mouth, your vision, your dental, your hearing. Something ever popular, especially in our Western Pennsylvania market, is those over-the-counter cards. So you have the over-the-counter cards and catalogs where you can buy items. We see gym memberships, things that maybe, again, aren't your doctor's visits or going to the hospital. It's going to be those extra things. However, I know a lot of clients that actually base their decisions, I need dental work done. It's something that can be very costly if you don't have coverage. So, again, you might not be a high utilizer in the fact that you're not going to the hospital or going to a specialist often, but you might be using that dental benefit or using that over the counter benefit. And yes, this is something that we've seen as, we had just mentioned, hey, we've been a little spoiled with those premiums, but we've been seeing a retraction in some of these ancillary benefits where they're losing the dental amount, where they're going from maybe first dollar coverage to a 50-50 co-insurance. So now, hey, I got dental work last year done. I didn't pay a penny. Now my plan is going to cost me half of the cost to visit a dentist. So again, if that's your concern, I want to know that when myself and my client experience reps are talking with you and doing that review, because if that's what's important to you, we might be able to find a stronger option for you that can help you with that dental. If you need a pair of glasses. And I had tons of people, I always say, hey, you don't want to shop based off those extras because at the end of the day, this is health insurance.
Right.
But I do have people that solely base their decision based on the over the counter. Maybe they're not going to the doctor and they say, hey, I'm getting this back out of the plan. It's money I don't have to spend out of my pocket. So again, if you're one of those folks as well, we can look and see where you can get the most bang for your buck and get the most out of that over the counter.
Yeah, I mean, it's interesting. I went to a graduation party a few weeks ago, probably about 4 or 5 weeks ago now. And one of the people there, I'd actually helped them with their insurance years ago. And their sister was there. And the sister came up to me and said, I understand you work with insurance and everything. And she said, I've been on this plan. I won't say the carrier name, but I've been with this plan forever. And I really, really like the plan. But the last couple of years, they've changed my dental coverage a lot. I used to get a $3,000 allowance, then it went down to $2,000, then it went down to $1,200 or something like that. And she's like, I'm really thinking about changing. And so we had a little bit of conversation. I said, yeah, happy to review and help you kind of look at the options. What I tried to explain to her is that change is happening kind of across the landscape, not on every plan, and it can change from year to year. But one of the areas where we do see maybe more dramatic adjustments is in those extra benefits because they're not considered core to someone's health coverage. It's helpful, it's very good, but it's not core. So if they have to adjust where they have with the prescriptions because of the pricing and stuff, that's where they're going to take away.
I had that conversation so many times last year. There were a couple plans that I think are very popular plans in the area that were in that similar situation. And as I was having conversations, most people, they were keeping some of the medical costs very, very stable year over year. But they were saying, hey, the last couple of years, my OTC went down, my dental went down. And really, that's where I just said, what's important to you? Because we would start looking over other plan options and realizing, man, we had this hospital copay that was a per day instead of a per stay. And if you went into the hospital, it would be very expensive.
Right.
So it really turns into a conversation about what's important to you, what you're going to utilize. I always say this, and it's so cliche, but we don't have a crystal ball. And at the end of the day, insurance is to protect you for your health needs, but you also want to get those extra benefits, get the utilization out of it. And it's okay to shop on those. Yeah. And I do have tons and tons of folks that like to shop on that. But really, truly, it's going to be just evaluating what's important to you and what you need.
Yeah, for sure. And so we've been kind of talking about the annual no change, what's good, what's bad, how the tailor-made can be positive and negative at the same time. We've talked about what changes the most. Let's get really practical for a minute. So if somebody's listening today, they're a current client of MediConnect, or maybe they're listening and they're not, but they like the service model that we provide. Can you just speak very practically to how do we do reviews for people? Like, are they all in person? Are they over the phone? How long does it take? What do they need to bring? What is a review or our support look like?
Absolutely. So for the specific time of year where our support is going to show, is we're going to usually schedule you for an hour-long review. I had some last year, went a little bit over that depending on the situation. So have that conversation,
a lot of prescriptions, a lot of doctors, a lot of changes that year. Yeah.
And you're going to want a list of your doctors and medications because we always want those up to date. Maybe you reviewed with us 3 years ago and you've had 2 new doctors and 2 new medications prescribed since. So we want that most up-to-date information. Then we do offer reviews over the phone and in the office. So we make office time. Our office is in Crafton, Kennedy Township, so you can come to the main office or over the phone.
Awesome. So then in that time frame, we'll review everything, answer all their questions. We'll be able to qualify if their current plan is still the best one.
Correct.
And if it's not, or there might be other options that we're aware of because of all of our preparation for the season, we'll be able to walk them through those options as well.
Absolutely. And I think that's something, we do very well here compared to other places I was in the Medicare world, if you will, is train and prepare our team because we have to go through training certifications yearly. We have to know these plans like the back of our hands, and we do this all day, every day. So, we're going to be expert in those plans and we're going to know the options in the area. Again, during reviews in the past, somebody goes, oh, well, my friend has this plan, but this person that I'm talking to is telling me how dental is very important and their friend's plan, the dental's not as strong. Whatever the case is, we're going to be able to have that conversation, walk through those plan benefits and help them make a selection. And, also too, you might want to stay with your plan and that's okay too.
Yeah.
But you now understand what changes were made, what could impact you and what benefits you're going to get for the next year.
Yeah. So a lot of our reviews, we do them over the phone, some via Zoom, a lot we do in office. On occasions when the scenario, is necessary, they can't hear real well or they can't drive or they're not real mobile, we will do reviews in their home. So we try to make it as convenient with the mass amount of people that need to be handled in a short period of time.
Correct.
I wish they would give us more time to make all the reviews, but 7 weeks can get really, really short. So now that I've mentioned 7 weeks, we've already talked about ANOC, Annual Notice of Changes, that is going to come out in mid-September-ish. I feel like it's been coming out a little bit earlier every year the last few years. What other dates are really important that the people listening today need to be aware of?
So if we have a SAR, which is a service area reduction, not sure if we're going to have them or
What does
not
that
in
mean?
the area, but last year we had a lot of these. And a service area reduction is when the plan is being removed from that service area. So this past enrollment season, we probably saw in our area more of these than I had ever seen in my career. So essentially, people were not having the option to renew their plan next year. And that notice has to be in by October 1st. So you might be waiting for your annual notice of change going, hey, what's going to change? And you get this other letter that says, unfortunately, your plan is no longer renewing. So that has to be in home by October 1st. Again, if you end up in that situation, don't panic. We are here to help.
Yeah, and I think that's a really good point to bring up because, if the annual notice of change doesn't come, many times it means the SAR is going to come, which is as a real pointed example, you live in Allegheny County, you have this plan, you're going to get a letter that says this plan is no longer going to be offered next year in your county. So it's being eliminated. You're not being crosswalked or automatically enrolled into another plan. So they have to pick a plan. So if they don't get the annual notice of change by mid-September to the later September, then they want to be looking for that SAR that says the plan has been terminated.
Correct.
And that kind of coincides with another important date, which is October 1st.
It sure is. So on October 1st, we were talking about ANOC and that annual notice of change. Before that, you get it. You can call me with questions. But if you want to explore those other plan options, on October 1st, we are now allowed to talk to you about all the plans in your area. So that is when we're allowed to have those conversations, start plan reviews, and look at different options.
Yeah, so we can answer general questions about Medicare and things up until September 30th, but we're not allowed to actually speak specific plan benefits until October 1st. So that's why if you get your ANOC and you're like, you know what, I want to talk to someone, you can call, get an appointment on the calendar so that when we are able to do that, we're ready to go. And then the next big date, so we got mid-September, we got October 1st, and then we've got October 15th.
October 15th. That is the first day we are allowed to accept enrollments. So last year, right, I had some people that got those SARS letters and they were going, oh my goodness, what do I do?
I got to get it done. I got to get it done. I'm not going to have coverage.
I would panic too, you know, and total totally valid emotion there,
Yeah,
and that's what
sure.
we're here for. So we did their review sometime between that 1st and the 14th. But even though we reviewed and they went, "Oh yes, I found the plan that I want to go with," we can't take their enrollment until the 15th. So that'll be the first day we can accept enrollments. And some of your reps may have talked to you and sent you a link out that you can sign on that 15th, or again, we can take that application over the phone or in person after the 15th. So the 15th on, we're allowed to now accept an enrollment form and get you enrolled into your new coverage.
Yeah, so again, we love early birds, right? We love people that are a little bit more proactive because it helps us to manage the workflow and get them set up for their January 1st effective date for the new year. And then the last big date, of course, after Thanksgiving is the mad rush, as
It
I
sure
like to
is.
call it.
Those are my people, my procrastinators. That's where I end up.
Yeah, I mean, Black Friday is the mad rush of the holiday season. The Monday after is the mad rush of
Correct.
the Medicare season because now everybody is pushing towards that December 7th deadline to get their plan choices selected before the end of the year.
That is it. So December 7th is the last day that we can accept an enrollment for the annual enrollment period. So during that time frame, that is the cutoff. If you call me on December 8th, right? If you are subject to the annual enrollment period, you won't be able to elect a change after that. However, we talked about SARS, service area reduction, those people that panicked and, you know, had to get a new plan. When you're in that scenario, that can actually extend
Yes.
to December, even into the next 2 months if you
Yes.
lost your plan. So again, we had a lot of folks call in with this scenario. Maybe they missed their letter in the mail, their SAR letter.
They didn't open
We
their
didn't.
letter.
Very true. We sent a letter if you were a MediConnect client, right? Because
Yes.
we wanted to say, hey guys, you should have received this letter. So we did follow up communication as well. But I had people that maybe didn't read that mail, maybe didn't get that mail, and they called in after December 7th and went, what do I do? And for those people, we were able to help them continue into the next few months. So there are options available.
Yeah, so a lot of great practical information. We've got about a month until ANOCs start hitting the mailboxes. October 1st, we're going to start talking about plan benefits. October 15th, we're going to start accepting enrollments for 1/1 effective dates. And then we need to get it done by the 7th of December unless somebody has a special enrollment period like the SAR that you mentioned. So are you drinking a lot of coffee and getting sleep? Are you
I'm
ramping
always,
up?
I'm always drinking coffee.
I do know that's why I
think
asked the
that
question.
I'm the one person in the office that if I don't have a coffee in my hand, people are concerned.
Yes.
And yes, trying to get sleep, trying to gear up. And yeah, I get excited. I mean, you start seeing all the plans changing, and it's a lot of good energy going on. Like we go into this 7-week window. I mean, our team is going all hours of the day. Our call center open, till into the evening. So it's an energy that you have to have. I think we're all cut from a little bit of a different cloth that we enjoy this to a degree. But you have to get yourself ramped up to be able to tackle the season ahead.
No, for sure. And, if you're listening today, our goal is to make sure that you have a trusted resource that you can go to not only during the annual enrollment period, but throughout the year. I haven't got my cards yet. What's up? I haven't, used my coverage. What should I expect? Can you explain this benefit for me? Like all year long, we want to provide that ongoing support to them.
And life happens outside of annual enrollment period. There's a whole nother world out there. We get so crushed during that time frame, but we have clients that move during that period and need to select new coverage. We have people that qualify for different enrollment periods or maybe certain types of prescription assistance. Like here in Pennsylvania, we have PACE and PACEnet. And if somebody qualifies, that can create a special enrollment window. People go through life changes. I've had people and clients diagnosed with cancer. And maybe, again, there's another plan suited for their needs in that scenario of like a large medical situation. And we can find a special enrollment and help them change. I had a lady at the end of the last enrollment period where she was waiting for results and her results weren't going to come till like December 9th. So she was like, what should I do?
Yeah.
And what we did was we enrolled her in the plan that we thought would be stronger if it was a
Bad diagnosis. Sure.
diagnosis. And I said, we have the open enrollment period, January through March. So
Well,
she
we can review again if we need to.
and make a change. So I said, if we get through this and get a positive diagnosis, we can go back and change to the other plan during that time period. And luckily we got to. So she had a positive diagnosis and we were able to go put her back on that plan that had a lower premium, but she was prepared and we were able to make those changes. But there's a lot of things that we can do all year round, like helping my friend that I talked about earlier, going through his situation as well.
Yeah. So, Lauren, I really appreciate you joining us today. I know for us, our mission is pretty simple. We want to challenge the status quo. It's in our mission statement of how healthcare is done, a high service model. We want to make sure that people have support, that Medicare is simplified.
Absolutely.
So they can enjoy their retirement. They shouldn't be stressing over their health insurance, their health care. MediConnect is there to really make it a lot easier for them.
That's what we're trying to do here.
Yeah. Thanks again for joining me.
Thanks for having me.
We're ready for another big season.
Here we go.
Thanks everybody for tuning in today. Before we end today's podcast, I do want to just share one of the Google reviews we got recently. We love getting feedback. We talked a lot about the importance of the customer experience, the client experience today, and that really, really does matter to us. And I love this review from back in June. It says, "I'm very happy with my experience with MediConnect. The webinar was very informative and helpful." We actually do a webinar every Wednesday, one at 11 and 6 p.m. And the reviewer goes on to say, "Then Logan met with me and helped me get signed up for Medicare," which we do. We help people not only with picking their private insurance, but we'll help you sign up for Medicare. I got an Advantage plan in this situation, although we do write a lot of supplements. He was very knowledgeable and very helpful, and I love this part, without being pushy. And that's really the approach, because we look at it as this is our goal, to help you. He made what could have been a frustrating task so easy and smooth. Thank you, MediConnect and Logan. And for me, Logan, shout out to you. Been an agent with us for 4 or 5 years now. Great with client relationships, really listening, understanding the needs. And that is always our goal, is to make this so much easier, so much smoother. Not a sales experience, but an experience where you get a great education and you're able to make awesome decisions for yourself. So again, thanks for tuning in today. If you haven't yet, please click subscribe. Every month we're putting out a new podcast on important and relevant topics, and we look forward to seeing you again soon.